as you all know, as we've looked in the media, there's a lot of attention to this kind of concern. And for all of the hype and panic and fear that we see online and on the media, I think the most important message that I can impart to all of you today is the importance of gathering facts. I think facts are the way we combat fear, and I think to the extent that we all can come away with a shared understanding of where we need to go, I think that is the most important goal that we could possibly achieve today. So with that, I want to say first of all that because this is a rapidly evolving situation, everything I'm about to tell you may change later on today. So point being is know where to go for accurate information. I'm going to give to you hopefully information that's not likely to change, but the reality that we've learned with the situation is that something new happens every day. So I want to start with what we know. We know that this is a virus. Many people have asked me, is it possible to have an antibiotic for this? The answer is no. There is no likelihood of having an antiviral treatment for this virus anytime in the near future. So we need to be looking toward public health measures to find a way to get ourselves through this situation. This is a novel virus, meaning that this is a virus that has never been seen before on the planet. And that sounds kind of scary, but there are many viruses that have never been seen across the planet. What makes this unique is that it is of a strain that is seemingly very virulent and has shown to provide a lot of illness, unfortunately, to older populations. And so this is primarily why we want to pay a lot of attention to it, and it is spreading quite rapidly, as you all know. We know that the incubation period is less than 14 days, meaning that from the point at which an individual contracts the virus or is exposed to somebody with the virus, we believe that they will become symptomatic within 14 days, if they're going to become symptomatic at all. The vast majority of these individuals become symptomatic within the first 5 to 7 days. So that is important for us to know because that's how we plan our quarantine process. And I think that's the interval that we all need to remember when we're thinking about identifying people who might be at risk and considering the question of whether they have been quarantined at home. So the period of quarantine at this point would be for 14 days at the very most. The cardinal symptoms to pay attention to are fever, cough, and shortness of breath. Those are considered to be lower respiratory infection symptoms. So sore throat, stuffy nose, and congestion, that tends not to be what we see with this illness. This tends to be lower respiratory, coughing, shortness of breath, and wheezing. I think it's important to point out that 80% of the individuals who have contracted this infection have mild to no symptoms. And I say that not to say that it's not something to worry about. It is clearly something we need to worry about. But I think we need to put that in perspective. The vast majority of people who contract this illness will not even feel anything. That being said, 20% of people will, and they will have moderate to severe symptoms. We're primarily concerned with the older age groups, people with chronic lung disease. Those are the individuals that we know have been most susceptible to having those moderate to severe symptoms. Really important is to know how this is spread. We believe that this virus is spread through respiratory droplets. So analogous to the flu in that way, all of the similarities to the flu pretty much end there. This is a respiratory transmission, meaning that when people cough or sneeze, people who have the infection cough or sneeze, we all emit respiratory droplets, and those droplets are thought to end at 6 feet. So a safe radius would be beyond 6 feet. Okay? This is not an airborne illness. Tuberculosis, measles, those are airborne illnesses. Those can linger in rooms for hours. We're not dealing with that here. We're dealing with a respiratory illness which has roughly a radius of 6 feet. So that is something to keep in mind as we think about congregations and so forth. And we believe this is person to person. This is not an object to person sort of situation. So people have asked me, well, should I be accepting packages from such and such location? Absolutely. We have no evidence to believe that this infection is spread any other way than from person to person. So to put it all in perspective, I pulled this off the New York Times. It's probably the best picture I could find that compares this virus to other illnesses that we are familiar with. So along the bottom here, along the x-axis, is this number called the R0. this purple box here is sort of where we think the contagiousness level is for this virus. So we think it's somewhere along the lines of 2 to 4. What does that mean? That means on average, somebody with this illness gone unchecked is likely to infect 2 to 4 people. To put that in perspective, measles is a 15. So an unprotected individual with measles is likely to infect 15 people. So measles is up there in terms of contagious. It's probably one of the most contagious viruses that we have to deal with. By comparison, the common cold is roughly around 2. So this is roughly a little bit more contagious than the common cold, much less contagious than chickenpox or measles. Along the y-axis here is the virulence, or the case fatality rate, how dangerous this virus is. And the common cold is generally not that dangerous, so that's down here by 0. Polio, seasonal flu is a 0.1. So the virulence of this virus is somewhere between seasonal flu and Spanish flu. So 0.1 to 2%. And that's a number that's changing because most of the data from which we gather that are coming from China. And those numbers are very likely to be skewed. We don't even have a number here domestically because we haven't tested enough cases. So the way to calculate this number is the number of fatalities divided by the number of cases, and we haven't measured enough cases. So we don't even have a good idea yet for what the case fatality rate will be here in the United States. So up until now, we've focused our efforts around containment. The idea that we can protect ourselves from people from the outside who might bring the illness in and keep all of us here who are healthy. So that means travel restrictions, that means screening at the airports, that means the quarantining and isolation that you've heard about so far. Testing, lab testing is very important in early phases of an outbreak. And the goal of this stage is to rapidly identify new cases, ideally cases of people who are already in isolation, so we catch them before they become infectious, so that we know that they have not infected anybody else. That's the goal of containment. And I will offer that we're at the point in this outbreak where containment efforts are not likely to be that effective that much longer, because we know that this is very likely coming to our community in the near future. Containment strategies are no longer going to be enough. And so that's why we're here, to talk about all the ways that we can work together as a community to prevent the spread of this even further. So I'm going to pause here and talk about travel. A lot of questions around travel. We cannot expect that we will avoid having this come to our community, but I do think that some prudent travel precautions are indicated. And we know that people who are coming from areas where there is community transmission, meaning transmission from a person to a person, that we are not able to trace. So early on, we knew that people who came from China were infecting people here. That was not an example of community spread. We had a link. We knew what happened there. But what we're seeing across the country now are people who are becoming ill without an obvious travel link. And in those areas, we're calling it community spread. Community spread is the risk because then we're sort of behind the curve, and it's going to happen everywhere, where you're behind the curve and you're seeing spread that you're not able to explain. So if somebody's coming from an area where there's community spread, you want to be thinking twice, even though they don't show any symptoms. Somebody coming in from Seattle would be riskier than somebody coming in from Batavia. Okay, so that's what we want to think about in terms of community spread. So far, we've been engaging with the CDC, the State Department of Health, my partners across the state, working on the airport screening. We've been quarantining individuals who've come from mainland China. I show this list not to suggest that it's exhaustive, because it's not. These are the efforts that we've taken thus far within Monroe County, but I do think that we all need to work together, because the Monroe County Health Department will not alone be able to protect everybody in this community. We need to work together and take reasonable precautions in our places of work, business, faith, homes, to do what we can to prevent this from spreading. Very important, the last 2 weeks, I've become either a travel agent or a party planner. That's the most common calling it now. Should I go to wherever, and should I? So I want you to know that the state has developed a hotline for many of those questions. It's listed here on the slide, 1-888-364-3065. Please feel free to use that, and we'll share some other numbers later on, but that is a good start for general information from the State Department of Health. So a lot has been said about testing, and I will say that we have not tested enough people in this community. Do we have enough capacity? That came up last night. The answer is yes. In the last couple of days, we've developed additional capacity to do more testing here in this community. And to be fair, we haven't had enough people that we wanted to test. Because currently, the requirements for testing are listed here, and they essentially require that you have symptoms. So we do not test people who have no symptoms. There's no reason, there's no logic behind testing people who do not have symptoms. So symptoms plus some other epidemiological risk, or somebody who's asymptomatic, who's been in contact with a known confirmed case. And then this other category here, which is primarily reserved for healthcare workers, because we want to be very careful about healthcare workers. So we may test asymptomatic healthcare workers who have other risks, because the chance of missing an infection in a healthcare worker is obviously very substantial. So, quarantine and isolation. Quarantine refers to separating people from the community who are healthy. Healthy individuals who have a risk, we will want to separate them because we want to observe to see if they develop the illness. So what's happening now on the SUNY Brockport campus is we have 31 individuals under quarantine. They're asymptomatic, they're happy, healthy students who are unfortunately being confined because we need to observe them to see if they develop symptoms. Isolation is the opposite. Isolation is reserved for people who are sick, people who are ill, people who have the symptoms of the disease of interest. And the idea there is to protect everybody else from coming into contact with them. So I won't get into all the details, other than to say that the County Health Department has a long-standing quarantine and isolation plan. And we put that plan into place about a month ago for the individuals coming back from China. It's the plan that we're using now for the individuals who've come back from study abroad. And the process is really very thorough. You know, for a voluntary quarantine, which is what we have in place now at Brockport, we conduct an initial visit, we evaluate them, we determine that they're asymptomatic, showing no signs of the illness, and we check in with them every day for that 14-day incubation period. If they even so much as sniffle, they hear about it. And then we're going to evaluate them and make sure that they don't show any signs of the COVID-19 illness. So that's a voluntary quarantine. Voluntary is kind of generous because it's not like they wanted to do this, but it's voluntary in that it's not involuntary. So involuntary is a much more restrictive process. We see them every day, and we are much more vigilant about their symptoms, even more so than the voluntary, because we have additional reason to do so. People who are being tested are people who are symptomatic and have the risk, and we put them under involuntary isolation, which is even more restrictive. And at the very end, if we determine, or if I determine that at any point these individuals are not cooperating with us, then we place a court order, which allows us to use the support of the legal system to keep them where they are. And we'll skip over the Brockport process. So, right now we're at the end of containment. So we're quarantining as much as we can. I realize that the days of quarantining and the days of containment are numbered, and we now need to shift toward community mitigation, non-pharmaceutical interventions, ways that we can all work together to prevent the ongoing spread of this infection if and when it does come to our area. So I want to spend the rest of our time talking about these NPIs, non-pharmaceutical interventions. And I want to encourage you to go to the CDC website, because on this website is all of the information, almost all the information I'm about to share with you next. There's information for your home, for schools, for businesses, all of the advice around mass gatherings, which I'll share a little bit of with you here at the workplace. All of these resources are available at the CDC website. For schools, there is information for administrators, for daycares, for schools, for kids with special needs, at work, for both administrators and employees, event planners, event attendees, so it's a whole host of information. And they have these NPI planning guides, which are very thorough, 20 pages each, and I would encourage all of you, if any of these apply to you, to avail yourselves of these resources. So the goal of these NPIs is to reduce the societal impact of a pandemic. The understanding, the assumption is that it's already here. And our job as a community is to work together to prevent or mitigate all of the impacts on our economy, on our businesses, on our schools, on our infrastructure, and certainly on our health. When you look at the plans, if you go to the CDC website, everything is going to be written about pandemic influenza. Everything that we're about to talk about now applies. So, and anything you see about pandemic influenza is going to be true for coronavirus as well. The most important point to remember about NPIs is that it's not something you just pick one and be done. Okay, it's important to consider all of these options simultaneously because some of them, as you'll see, will take time to develop. Okay, so there are things that we can do today. You already are. You're not hugging each other. Okay? You're not shaking hands. Those are examples of NPIs. Those are obviously much more easy to implement than some of the other ones I'm going to share with you in a few moments. So from a graphic sense, this is the image I want you to consider as we consider how we work together to implement these non-pharmaceutical interventions. So the purple curve here is what an outbreak might look like if we do nothing. Throw up our hands and say, bring it on. Purple is what will happen. Okay, so this curve here, this is time on the bottom. The epidemic will start earlier if we do nothing to prepare. The surge in cases will be high and steep, and the total number of people who get ill will be greater. Okay? The goal of these non-pharmaceutical interventions is to delay the onset of the outbreak here, so there's a delay in time. The surge is much shorter, and the total number of people who are becoming ill is less. The really important point here is this line that I added. This is obviously all hypothetical, but the idea here is at a certain level, we're going to reach hospital capacity, and that is not a capacity that we can change very rapidly in any community. So if the surge, without doing anything, exceeds hospital capacity, then we've got a real problem. So the hope is that with these non-pharmaceutical interventions, we can decrease the total number of illnesses, delay them, and shorten that surge so that it falls within our existing hospital capacity. Right now, we know that the flu season is on the decline, and the longer we can wait, not that we really have a choice, but the longer we can wait to have a surge in coronavirus tests or positives means that we will have more capacity because we've been able to discharge those people with the influenza illness out of the hospital. So these NPIs fall into three categories. The first are personal ones, things that you and I can do today. Environmental ones that I think are very important, particularly in workplaces, public settings, and so forth. And then the community level NPIs, which I think are the ones that tend to generate the most questions and concerns. So these personal NPIs are ones you've heard me talk about before. Washing your hands, 20 seconds, soap and water. We know that this virus is constructed with a certain kind of lipid membrane, which is very, very destructed by soap. Plain old soap is much more effective against this particular virus than sanitizer is. Sanitizer will work. It's got to be greater than 62% alcohol, but soap is much more effective for this particular virus. Hardest part is not touching your face. Studies show that we touch our face like 80 times a minute. It's very, very hard not to do that. Okay? I all look at each other. But that is actually the most important piece of that hand hygiene situation. Respiratory etiquette means coughing into a tissue, coughing into your sleeve, avoiding coughing into thin air. And the last point is voluntary home isolation, which essentially means stay home if you're sick. Isolation is people who are sick, so stay home. And I think in a workplace, we've got to be very careful looking around at our colleagues. If anybody is, showing any signs, pull them aside and say, are you feeling okay? Those are the kinds of social pressures that I think are much more important now. The consequences of having an ill individual in the workplace are so much more substantial these days. So there are personal NPIs that we would consider if there's a pandemic. So if there's an outbreak, an epidemic in this community, there are NPIs that we would consider, and and this would be something you have to talk to your employers about, and we'll get into that in a little bit. But if you have, for example, an individual in your household who is ill, and we're in a situation where we have a community transmission, we're in an outbreak in this community, the recommendation at that point will very likely be everybody else in that household should stay home. Okay? If you've got a confirmed case at home, the goal would be, not that it's easily practical, but the goal would be for everybody in that household, including kids, to stay home. And that is going to be a larger discussion that we'll have to entertain in probably the near future. Face masks. A lot of questions about face masks. You've seen the memes online. People wearing all sorts of face masks on the back of their head. There is no reason for healthy people to wear masks, period. Masks are medical equipment. They're intended to be used by medical professionals and first responders, and we need to reserve those resources for those locations, because we know that they're a limited resource, and ironically, most of the masks that we use here in the United States are produced in China. I'm not getting any from China right now. So that is a concern that we need to address. And so 3M in Minnesota is now ramping up, and they have a supply line that's about to go online, and they're going to start producing more masks in the near future. Environmental MPIs, I think these are very important. There's guidance online on how to clean. There are examples of disinfectants that have been shown to be useful against this particular virus. Most important piece about environmental MPIs is not how you clean, but what you clean. Going around your office, doorknobs, elevator buttons, the light switch panels, keyboards. There are actually studies of all the microbes on keyboards, and you do not want to read those studies before you eat. So be very careful, and I'm being very serious. The environmental MPIs, if you're going to have a workplace, everything else that you might do is all well and good, but if we're not cleaning our surfaces, then a lot of the other interventions that we might consider will not be as effective. So let's end with talking about these social distancing approaches. The goal of social distancing is to reduce transmission from people who are in the same airspace. Reducing face-to-face contact as much as feasible, separating again people who are sick, sending them home, and to the extent possible, keeping that 6-foot radius. Now obviously that's not always possible, but whenever it can be, we want to think about ways that we can make it happen. So for example, in a school or a college setting, is it possible to divide that 100-student lecture in the traditional lecture hall into smaller groups? Is it possible to have meetings as opposed to a meeting this large? Is there a way to have it done at a distance or break this meeting down into more groups? Those are the kinds of things we want to think about. Is it possible to do telecommuting, work from home, school from home? Those are the kinds of things that we need to be preparing for, because I would guess that most workplaces and most schools can't just make that happen on the turn of a dime. So we need to prepare for ways to do that. Lots of questions around mass gatherings. And so let's talk about the considerations around mass gatherings. Unfortunately, there is no formula. Obviously, you all know that the St. Patrick's Day Parade is coming. I've been asked many times, I'm in consultation with the planners. They want to know the moment at which I think it's not a good idea. I will definitely tell them. I think right now it's fine. Okay? And the reason I say that is because we have no evidence of community transmission here in Monroe County. We have no cases confirmed here in Monroe County, but obviously that can change any day. But as of this time, there is no community transmission. So one of the most important considerations in an event is when it is occurring relative to when there's community transmission. So if community transmission happened 2 weeks ago, and we have evidence that there is more widespread transmission here in Monroe County, I would not recommend that we go ahead with the parade. But that's currently not the case. So at this point, I would say go ahead with the parade. We know the properties of this virus. We know that it's transmitted within 6 feet generally. That's helpful. If we were talking about a measles outbreak, there's no way we would have a parade. Okay, so just to give you a sense of how we look at this. What's the nature of the interactions? A parade, obviously people are going to be in close contact. That's a more risky situation, but because we do not have signs of community transmission here yet in Monroe County, that 6-foot radius concern is not as compelling. important, and the hardest part probably about predicting around events is who's coming in. So I'm going to make the assumption that the St. Patrick's Day Parade is not going to gather an international crowd. This tends to be a local crowd, which is fine. But that is honestly a variable that we cannot predict. People have asked me, should I have our conference? Well, I ask, where are your conference attendees coming from? Well, they're coming from Westchester and Boston and Silicon Valley. I say, well, it's probably not a good idea for you to have that. So it depends on where people are coming from. And then the last consideration is who's going to be at the meeting relative to what we know about the virus. So we know that this is a virus that tends to impact older people more than younger people. In fact, there have been really no cases, really no deaths in the pediatric population in this instance. So we're really concerned about people who are 65, 70, and older. Those tend to be the people who are most likely to be impacted, people with chronic lung conditions and so forth. So again, I think the parade attendees are all ages, probably more skewed to the younger ages. But again, those are the considerations that we have to take into account. But the hardest part, unfortunately, is that there's no formula. And I think this is something that all groups will have to step back and ask themselves, at what risk are we able to tolerate? Schools, big questions around schools. What I will say about schools is that if we're going to consider closing a school, and it would take a lot of conversation before we got to that point, but if we're going to close a school, it would be in response to community transmission evidence within that district. And the goal behind school closures is to do it preemptively, before there's signs of widespread outbreaks within a school. Okay? That is what the studies show is most effective to contain an outbreak in a particular community. If we wait too long, then there is no chance of containment because there are too many people who are ill. If you have enough teachers who are sick that you can't deliver curriculum, if you have enough students who are sick that you have nobody to teach, then you have to close the school down, and it really is going to be too late. So we do not want to get to that point, because then we'll have exposed ourselves to too much illness, and the goal would be to prevent it from getting to that point. A lot of questions around how long. How long would we close a school? How long might we need to close a business? And for this particular virus, or for any virus, it's 2 to 3 incubation periods. So that means 6 weeks. We're going to close the school down preemptively, it would be for probably 6 weeks. Now that guidance may change depending on particular circumstances in that district, but the general recommendation is if you're going to go to that extreme, you got to do it right. Closing a school down for a week is probably not helpful. We just learned from the State Department of Education the other day that at the moment that we learn of a positive in any school, it's a mandatory 24-hour closure to allow us to go in and do the contact tracing and try to figure out who staff or students might have been in contact with that person. So more to come about that. There's a lot of guidance coming out literally every day around these school closure issues, but there's going to be more conversations certainly before we entertain these options. So in a graphic sense, this is what we want to see when we're implementing or considering these non-pharmaceutical interventions. We're right now in the investigation stage, all the way here on the left. All right? This is where we want to be. This is where we want to be planning. Because by the time we get to the beginning of an outbreak in a community, there will not be enough time to do the planning necessary to implement most of these steps. Closing down a business, closing down a school will require a lot of coordination, and you do not want to be doing that in a moment of urgency. So now is the time that we should be preparing. Many of you hopefully have some version of a continuity of operations plan. This plan is really intended to motivate groups, businesses, departments, schools to have a conversation about what it would be like to continue your operations with 10% of your workforce out, 30% of your workforce out, 50% of your workforce out. At what point do you think we'll just have to temporarily close down? Those are conversations that need to happen now, because I would bet that nobody in this room can say, well, I got a lot of extra people lying around that aren't doing anything. Okay, that is unlikely. So what can we do to maximize the workforce? And if we need to prioritize certain things, what would those priorities be? What is absolutely mission critical? What are the things that can be deferred? Those are the kinds of questions that we want to So that will essentially wrap up my remarks. I want you to be considering all of these questions now when you have the luxury of time. Right now, we have no evidence of community spread. I am prepared at any day to make that announcement. And when there is community spread, do not panic, because you have a plan in place. You've been thinking about these questions for long enough that you know what the next few steps will be. And most importantly, take this information home. Share it with your friends, your family. Hopefully, I've shared with you information that can be reassuring. Okay, I think the 6-foot radius thing is what many people tell me they didn't know. Okay, so the silver in the corner, well, if she had coronavirus, I would have no problem standing right here. Okay, and those are the kinds of things that I think people need to know, so we don't panic and worry about walking through a space. So with that, I'm gonna turn it over to my colleague, Tim Arning, to talk about the HR aspects.
Thank you. Okay, Dr. Mendoza is always an incredibly difficult person to follow. He's also the busiest man in Rochester, so thank you again for being here. We're going to provide just kind of some practical do's and don'ts as far as what we should be doing as employers to kind of help us all through this potential crisis. Just at the outset, we need to understand that really what's guiding this analysis and informing all of our obligations is the Occupational Safety and Health Act. And there's no specific regulation or law under OSHA that tells us what to do exactly in this situation, but we are guided by the General Duty Clause, which basically provides that employers have an obligation to provide safe and healthy working environments for all of their employees. Other than that, the only thing that is specifically regulated by OSHA, or the only guidance that we have as a specific for this scenario, is to understand that if we know that an employee is infected in our workforce, that's an OSHA 300 reportable condition. That's it. That's all I can tell you from OSHA. But there's been any number of publications by OSHA, by the DOL, by a number of federal agencies that were related to the pandemic flu that we have applied for this situation, and that OSHA and the DOL have updated for the specific coronavirus situation. So we are at least not operating in a vacuum. What can we do? The first thing we can do, or we should be doing, and this is a great segue, is we should be performing a risk assessment and thinking about what we can do now. We want to think about the industry that our employers, or we as employers, are in. So are you a low-risk employer? These are employees who have a fairly low likelihood of coming into contact with an infected person. So these are people that work in offices, or who maybe work from home, different things like that. Medium risk of exposure are going to be people like teachers, bank tellers, grocery store cashiers, those who are coming into contact regularly with the public. Medium risk of exposure, greater likelihood that they may be infected. And finally, we have high risk employers, and those obviously in the healthcare industry, but in addition, those in the travel industry is particularly appropriate here for coronavirus. This is, I think, probably true in a lot of pandemic situations now with how global the economy has become, but given kind of the specific areas, those working in the travel industry who were maybe flying to China were very high risk very early. So perform this risk assessment, and then the suggestion would be to create a task force to think about, as we said, what are your mission critical operations? What would your workforce look like if you lost 30 to 50% of your workforce? And considering that, some people will end up infected, right? I had the flu a couple of years ago. If you had said, just work from home, I was like, okay, well, I can't speak or lift my head off the pillow, so I'm pretty much out, right? I'm not going to be helpful, but if it's someone's child at home who is maybe infected, could they work from home, or are they maybe exposed? They just came back from vacation to China, but we want them to stay at home for the incubation period. Those are people who could maybe work from home. We want to be figuring out those tasks. And so the task force would really look at this. You want someone probably from IT, someone from sales, someone kind of from each department who says, what are my absolute critical needs, and what are my risks of exposure, and how do I address those? These risks of exposure, high, medium, and low, come from OSHA itself. I would also add, when you're thinking about, whether you're a low, medium, or high-risk employer, is you want to look at your employee population. Do you have older workers who are more vulnerable to this disease? Do you have workers who are more savvy, working remotely? Do you have people who are taking public transportation to and from work, higher risk of exposure, most likely? Do you have folks who are maybe low-income workers or are less likely to access healthcare, to take preventative measures? All of that should be taken into consideration when you're looking at your workforce and trying to assess, what's my risk and what are my solutions. Next, do is communicate with employees. What are we doing? What should you be doing? What can we be doing? And we've got any number of things to communicate. The first is, should be communicating remote work options and also rules. So this is, when are you permitted to work from home? When are you required to work from home? What are the expectations when you work from home? Most importantly, how do you record your time for non-exempt employees when you're working from home if they can't punch in or they don't have a fingerprint scanner, whatever the case may be? Is it acceptable to also keep your children home with you? Is it free daycare if your people are working from home? Is that permitted? What positions are absolutely, we can't have you work from home. Your job is to be a one-to-one healthcare aide. How would you do that from home? You can't bring the patient with you. We want to look at what positions permit this. I caution here that these should be similar or identical to the people that we would permit to work from home if they had requested an accommodation to work from home under the ADA. So if someone has a disability or they need an accommodation, they say, I need to work from home, my doctor says I need to work from home. We say, no. We don't permit that. Your position, an essential function of the job is to be on site. And then they come and say, well, I might have been exposed to the coronavirus. Well, stay out of here. Don't come in. You can do your job from home. Absolutely. Of course you can. It's so easy. Look at it. Well, we want to make sure that we're being consistent so that we don't box ourselves in. The other piece is you want to think about, what are your network security parameters? What security do employees need to work from home? Do they need a VPN? Do they need a patch installed on their iPhone like I do before I can log on anywhere? And can we get those things installed while employees are actually at the office or in their workplaces? And similarly, what are your document policies? Do you have protected health information that can't maybe leave the premises? Or do you have specific rules around what can be taken or what should be taken? You absolutely can't take these documents in hard copy home, but you definitely should be taking your computer home every night in case we have to shut down. What are you communicating to employees and what are the expectations? Similarly, office leave policies, we want people to understand what are the rules around sick leave. I think that this is pretty commonly known, right? Everyone knows how much PTO they have or what the rules are, but we also want people to understand what documentation is required, both to be out for a significant period of time, but also until you come back. And I had a client yesterday say that one of his employees told him he thinks he has the coronavirus, so he's going to go home for today. She's like, well, I don't want to not take this seriously. This is a big deal right now, right? But also, this guy is kind of full of baloney, and we all know it. We don't want to call him on it. But by the same token, if your employee thinks that they've been infected with coronavirus, pretty much the rule is, great, see you later, and don't come back for 2 weeks. An employee should understand that that's the expectation. That if they have a known risk of exposure, that we're probably not going to permit them to be in the office. Or if he's been tested and does not show, if the doctor clears him to return to work, well, then we would permit him to come back. But it shouldn't be kind of a get out of work free card. It's a get out of work free card maybe for 2 weeks.
Should you require a doctor's notice?
Before they return to work? I think I would say either the incubation period, let the incubation period run, or have a doctor's note clearing them to return. I think that covers your basis. Particularly if there's a legitimate concern that the person has been infected. This employee who, I was like, let's just teach him a lesson. He's not going to do this again. So he'll be out for 2 weeks most likely, but we don't want to scare employees to say like, oh no, if they report any symptoms to us, now they're going to lose work for 2 weeks or have to burn through 2 weeks of PTO or maybe take it on time or unpaid. We want want to balance that, but these are things we need to think through. What are your policies going to be with respect to that? We also want to think about travel policies, and I'm going to talk about those more in a little bit. Simple things though, like the location of your cleaning supplies. It's all well and good to know that my keypad is filled with germs and disgusting things. Thank you, Dr. Mendoza. But thanks to our really excellent folks here at Nixon, I also know that our cleaning supplies are on the 9th floor, and I know where to get something to wipe down my phone and wipe down my keypad. And keeping workplaces and work surfaces clean is going to be, like we said, a really important piece of this, and we can't do that unless we know how. So if I went to Chipotle the other day, everyone was wiping down the surfaces. Our 9th floor people wiping down with cleaning products, those types of things. We can't do that if we don't know where they are, so the more we can kind of disseminate that information. We also want to let employees know that we are monitoring the situation. We know that it's an ongoing public health concern. We can tell them we attended this seminar. We can tell them that we're looking at the CDC websites. We're closely monitoring these situations. We know that they're fluid, but we will be up to date. We're taking care of you, and we're thinking about it. And we're not just kind of throwing our hands up and saying, well, pandemic, what can you do? Finally, the other thing to communicate is what are your plans in the case of an emergency? And most importantly, how will employees be notified? Do you have up-to-date contact information if you're going to have to shut down, or if you're going to tell employees not to come into work? Do you have their phone numbers, their email addresses? Can you do a test to say, okay, this is just a test in case we need to shut down? Did everyone get access to this message? How are you communicating? Better to be prepared than have people be uninformed. Do not require travel if employees have legitimate concerns of exposure. This is a very fluid situation. I gave this same tip like 2 weeks ago, and I said, well, if you have an employee who doesn't want to travel to Virginia, that's crazy. And then yesterday, I canceled a work trip to Virginia. But it's a changing situation. So we always want to look at the risk of exposure. If you are trying to send employees to very high risk areas where there's a lot of exposure, we really only want to do that if it's absolutely necessary. We also want to balance the employee concern. When we talk about the Virginia trip, I think there was a fairly low risk of exposure, but my coworker was very concerned about it. And so, does it make sense to be like, come on, Eric, we're going? Especially when, third example, this was just kind of a client meet and greet. There was absolutely no reason that we needed to go at this particular time. We want to look at these 3 factors all the time. So if the trip is to Nixon Peabody to come to this seminar and it's important information and you're not concerned at all, well, that makes the analysis from an employer perspective probably pretty easy. But if it's, I have to go to Rochester, can that be done by phone call? Can we Skype? Can we postpone for a couple of months? What is the business necessity? Do I have to send someone there? And does it have to be the person who is the most concerned about it, right? If you have someone who's like, oh, I'm 22, feeling pretty good, run every day, if that person doesn't care, then maybe that's the person who can go in the stead of someone who's less desiring of that. We also want to make sure that we're requiring reporting of illness and or recent travel. If employees think that they have symptoms, we want to know about that. We want to send them home. We want to make sure that they're not coming to work. We also want to know about their travel. And when I say travel, I mean all travel. It's not just what we're making them do, which we should have our finger on the pulse of, I would think, but it's also what is your personal travel. And before you ask, yes, you can ask that. That's okay. There's no prohibitions on asking or requiring travel plan reporting, and especially because we want employees, if they have a personal trip coming up, right? They are going on a cruise. I don't know why you would ever, because of the scariness of quarantine. That's just my own irrational fear. If you have, learn about me while you're here. If you have an employee who's going on a trip and you think that there's a risk of exposure, or they're going to, maybe they have a trip to Italy planned, whatever the case may be, they need to understand that when they come back, we're probably going to say, you're going to work from home for the next 2 days, or you're not going to be permitted in the office and you're a non-exempt employee and you're burning through all your PTO. You know, what are the expectations? We need employees to know upfront what those rules are to the best that we can, and then they can make their own decisions about whether the personal travel is required, or whether they're still gonna take the risk, or whether they can manage that time. That said, things we cannot ask are like, gee, are you affected by the coronavirus? Or you're looking, you look like you have symptoms. Now, if someone's actually showing symptoms, yes, we want to apply social pressures and we want to say, can you please leave, get out of here, if they actually are exhibiting symptoms. But we don't want to discriminate on any perceived risks of exposure. We don't want to say, well, you're Italian, so you know, you should go home. Everyone who's Italian cannot work here. That's probably going to be a bad idea. But also, if we have employees who believe that they've been exposed, or who have been diagnosed, they've been tested, and they inform us of that, all of that is employee health information under the ADA, and therefore is subject to protection. So we cannot disclose that information unless the person we're telling has a need to know, right? So this maybe is a supervisor, or in this situation, it might be those with whom the person has come into contact, but I would exercise caution on that. Can we kind of anonymize it a little bit, or say this whole department is going home, or whatever the case may be? We want to make sure that we're being careful with employee medical information.
Can I ask a question about that?
Yes.
I have an employee who is very open about a previous health. He's a transplant patient. And he was supposed to travel with the crew to Denver this week. And we opted to ask him to stay home because we didn't want to put him at risk of being in airports. Because if he catches a cold, he's immediately in the hospital. Like his immune system is very compromised.
Okay, so the question is, I have an employee with a compromised immune system due to a transplant. Can I require the employee, or is it appropriate to require the employee or not permit the employee to travel? There's like 9 questions in there. So, so one is, if an employee voluntarily discloses or is telling people across the board, I am a transplant recipient, I'm a coronavirus victim, whatever the case is, that's fine. If they're telling people on their own volition, that's number one, so let's address that. Then the question is, well, this person has a compromised immune system. I think if we're looking at travel policies, as you are, the employee concern is probably very heightened, right? So in that case, we would not want to probably require that employee to travel to Denver, even though it's probably a low risk area. With the ADA, however, we want to make sure that those inquiries and concerns are coming from the employee, and that we're not saying, oh, gee, Bob, you are a transplant victim, you can't go. The employee should request it, or we can offer, but we don't want to be just kind of making our own rules about what the employee can and cannot do. That should come from the employee and or his doctor to say he can't travel, he shouldn't travel. We can always accommodate if he's not the person to travel, but we can't institute our own views as far as what people can and cannot do. So that also brings up another good point, segues right into my next one. We also want to avoid other invasive or legally protected inquiries. So if we say, like, has anyone here had a transplant recently? Does anybody have a compromised immune system, suffering from cancer? Anybody? You know, what are the conditions that might make you vulnerable? Or, oh, how old are you? Most people are about your age, that type of thing. Do you have children that might, be exposed? Even if you're trying to get a sense of what your likelihood of your absenteeism rate is, we want to avoid inquiries that would be prohibited under the discrimination statutes, and also just things that we don't want to know, because if we don't know them, we can't discriminate on those basis. So if I don't know that this person is 73, I don't need to ask. If I don't know that they have a medical condition that might make them more vulnerable, I again don't need to know, because those are the types of things that can come back to bite us later. We can ask things like, gee, what's your home office setup like? Do you have Wi-Fi? Do you have the capability to work from home? Do you ride the bus to work? Those types of things, those would be appropriate inquiries, but anything we wouldn't ask in a job interview, we would probably want to steer away from. We also want to keep in mind any applicable leave laws. For here, we're talking particularly FMLA or paid family leave. From an FMLA perspective, infection with the coronavirus could possibly be considered a serious health condition that would require up to 12 weeks of unpaid leave as appropriate. Now, as a practical matter, the FMLA is probably going to be the least of your concerns. One, because it might not even apply to you, but two, because if the employee has coronavirus or the risk of coronavirus, you're not probably thinking like, oh, this person's not reporting to work, like, get rid of them. You're really like, please stay home, do not come here, go away. So it kind of becomes a moot point. You're likely to grant that unpaid leave, but if they are hospitalized or incapacitated as a result of the virus, FMLA likely would apply. Same thing with paid family leave. Paid family leave has that little wrinkle, as it always does, that if the employee, him or herself, is infected or hospitalized, incapacitated, no right to leave, no right to payment. But if their child, their mother, any of their family members covered under the law is infected, then they would be eligible for leave and payment under the law. That does not apply if the employee's child is sent home from school or otherwise quarantined. We would actually have to have that incapacitation or hospitalization. I see some hands going up. I'll get to those at the end. I don't want to keep people here forever. In any event, we want to make sure that we're also keeping in mind the applicable wage and hour laws. We talked about sending people home. We talked about remote work, different things like that. All of those are going to implicate the FLSA and the New York labor law. As I said before, particularly for non-exempt employees, when they're working from home, they need to be paid for all time work. Anything that we're aware of or should be aware of, they need to be paid for that time. For salaried exempt employees, of course, they have to be paid if for any days that they perform any work, including a couple of phone calls, whatever the case may be. And as most applicable for coronavirus, if salaried employees are ready and able to work and willing to come in, and we say, we think you might be exposed, or you just got home from a trip to a particularly vulnerable area and we're not letting you come into work, they should likely be paid for that time. That's our recommendation, is they should be paid. That's the way the salary rules work. So if you are keeping people out and it's your decision, you can't come into work, and these are salary exempt employees, they should be paid for the time that they're staying at home. Now again, in an ideal situation, they're also working from home, so it should maybe be cost neutral, but we want to make sure that we're not violating wage and hour laws. Couple more. Consider personal protective equipment if you have a substantial percentage of your workforce becomes infected and there's no ability to shut down. You may have to provide personal protective equipment like masks, things like that. That's going to be mostly for the healthcare industry, I would think, but something to keep in mind. And finally, make sure that we're not sending mixed messages or being myopic regarding PTO use. I think whenever we're talking about sick leave, there's always this balance, right? Where stay home, stay home, stay home, and then it's like, oh yeah, Kim was out for 2 weeks. Like, we make people feel guilty almost about their use of PTO and their use of sick leave, or were you actually sick? There's I think a couple of memes going around on the internet that are like, you never feel guiltier than when you're legitimately sick and calling in for work. Like, I'm so sorry I can't be there. We want people to stay at home in this type of scenario if they think that they're infected. And if that's what we want, we need to be consistent with that message and not say like, oh, okay, yeah, I'm sure you have coronavirus, whatever the case may be. Need to be consistent, because if employees feel like they should be coming into work or like they're going to be disciplined, that's a disincentive for them to actually use their PTO. The other piece is, you're going to have a lot of employees who run out of sick leave, might not have time, and now there's economic reasons why they're incentivized to come into work. And you may want to consider whether it's worth it to pay an extra week or two for certain people, or probably workforce-wide. Do you want to allot contingency PTO or coronavirus PTO or something like that, where Yeah, sure, it's a cost up front to keep certain people out of work, but it's cheaper than the alternative, which is operating with half of your workforce when everyone gets infected, or, having to shut down for up to 6 weeks. So those are the things that we want to keep in mind. I will say, I'm very proud to work here. We have been very proactive with respect to coronavirus. We are getting constant updates from our HR folks. I think they have very good counsel, but but we're working together, and it is good to be prepared because one, all of our employees know exactly what's going on, what our expectations are. We are, I know to take my computer home every night, like I'm not doing that anyway, hilarious. But we know to take it home. We know where our supplies are. We know what our anticipated impact is. We know what travel plans look like. And so that's good from an employee relations perspective, taking care of people, making sure that folks aren't getting sick and that their health is a high priority. But it's also, that ensures contingency of our staffing, that we can meet client needs. And particularly as we're seeing now, we're getting a ton of requests from both vendors and clients to say, what are your business continuity plans? If you get hit with coronavirus, what are your plans? And we're getting any number of inquiries on that. So all the plans that we put into place, even if nothing ever happens, we at least can respond to and reassure our clients that someone will be here, the lights are gonna stay on for us. And I think that's really valuable from a business perspective to say, these are the, this is what we're doing, and this is how we're taking care of our people and taking care of you as our clients. Other questions? Yes.
Just any questions on anything?
Yes. I mean, on coronavirus and employment, otherwise, the floor is yours.
Actually, this question is kind of for you and for Dr. Mendoza. I'm looking for some additional guidance on the 6 weeks, because I know. Oh, sure. I'm looking for some additional guidance on the 6 weeks, because I know I'm going to get that question when I go back to work, as opposed to the 2 weeks. So say we have a facility that we decide to shut down. So that's one question. And then the second question is there any guidance on when would a business decide to shut down? So is it, if you have one confirmed case, if you have 10 confirmed cases? I think they're just looking for some guidance from a medical perspective.
That's tough, because again, there's no formula. It
Right.
really depends on so many variables that I don't even know about your workplace yet. The 6 weeks is sort of a general rule that we use in the health department whenever we're looking at containing a communicable illness thoroughly.
Okay.
So that's just public health rule, kind of what we do. But it doesn't mean that it's inflexible. So depending on the circumstances, if we can ensure that there are ways that you might be able to mitigate the exposure within your workplace, then we might consider a shorter one. But I will say that I think the state is due to come out with additional guidance on this piece. This is one of the later steps that in their mind that you want to know about. Obviously, in your mind is what you want to know about now. But there will be more guidance around that. What I would offer is, feel free to call us in the health department if you have questions. I will put my email up at some point. If you're welcome to email me, and we can walk through some of these steps. But it's just so hard because there isn't really a formula.
Thanks.
And just from an OSHA perspective, I think, this is always going to be a sliding scale as far as your obligations. If you have known exposure or known infection in your workplace, your obligations are going to be different if it's 1% of your workforce versus 60% of your workforce, or what the exposure is. And so we always want to balance. Again, your duty is going to increase as the exposure increases. And if it's one person, probably no obligation to shut down. But if you have high risk of exposure or actual exposure, definitely changes the calculus from that perspective as well.
Hi there. If you could just, from an HR perspective, parse out a little bit farther that example that you talked about where the employee says, I think I've got the coronavirus, I need to go home, or I have a family member who's home because they may have been exposed, between FMLA and PFL, which you touched on, but also the possibility of disability coverage if that employee that goes home has some medical diagnosis of symptoms?
So disability coverage is going to depend on the terms of your plan, first and foremost. Short-term disability, you have to be out for at least 8 days, and just think they have coronavirus, you know, that's gonna be really a business judgment on your part as far as the risk that they actually, whether this is a legitimate concern or whether it's not. But this is an area rife with complication. You know, like we had an employee, I talked about the ADA, not me, I advised, there was a client who had an employee with attendance issues, and now they wanna work from home, and you know, we said, no, it's an essential function of your position to be on site. And then we asked, who can work from home if coronavirus comes? And you know, what are our consistencies? You know, we can't treat this employee differently in this situation than we would across the board. And we can't treat problem employees necessarily different than we do other employees, or we run into risk of discrimination and things like that. So from an HR perspective, it is very case by case, employer by employer, and we can work together to figure out what makes sense for you. But there is no generally speaking, so, sorry.
This is for Dr. Mendoza, and I can understand if the answer is purely speculative at this time. But what is is there anything known regarding reinfection or like repeated infection? Somebody could have these twice.
Well, with any infection, you can have it twice depending on your host immune system. There's no predictable way to know who that might apply to. So, you know, even H1N1 flu, you can be reinfected with that multiple times. It's less likely because if you contract the infection once, you should develop natural immunity, but not everybody develops natural immunity in the same strength. That all being said, we don't know enough yet about this virus. We don't know about its natural history, and it's not been around long enough for anybody to have long-term kind of studies to answer that question.
Just kidding. I have so many questions, but on the practical side, I'm conflicted between wiping down surfaces and it's only human-to-human touch that transmits it. So how important is it that we wipe down our own surfaces or even a conference table?
Well, it is human to human insofar as when we cough, we spray respiratory droplets for 6 feet. I know it's gonna make you all germaphobe now. Those respiratory droplets are on surfaces, and we don't know how long these droplets persist on surfaces in this particular case. So I think the better part of caution is just to, you know, take those steps. But I think table surfaces are probably less risky than the bathroom light switch, for example.
Yeah.
So we talk about how we treat our employees when perhaps we think they may be symptomatic. However, if you have the public engaging with employees in the same spaces, what, if anything, would you recommend or suggest about how we might approach the public or our visitors when they may exhibit what we would normally talk to our employees about?
True. So the question, before I pumped it to Dr. Mendoza, just kidding, I have also an answer. The question is, we talk about what we do with employees, but what do we do when we have customers or we have to interact with the public, and what are our obligations there? Two-part answer.
So, you know, I think it depends on the nature of your workplace. So we're engaging in discussions today around nursing homes, you know, taking very drastic steps to limit visitation to nursing homes because we know that that is a higher risk situation. I think if you're a restaurant, for example, you might consider having a sign at the door saying, those are the kinds of things that you could consider. But honestly, I think the most important message that we can get out is just sort of a general message: stay home if you're sick. Because we don't want to impact local business any more than we have to. We don't want to discourage people from coming to our businesses to engage in the work that we offer to them. So it's a balance. I wish I had a rule, but high risk situations, nursing homes, healthcare settings, we're actively screening people who walk into the hospital.
I think that we were looking for, and we have been communicating and do have a plan about this, but when our employees begin to become more concerned about their own well-being, and then they may interact with the public, who might make them feel maybe slightly more threatened because they think they see a symptom that could hurt them. Do you have any other recommendations, just because I wanna make sure we're thinking clearly about how, or what you might suggest we have our employees trained to do? And we have some recommendations already, I just wanna make sure I'm covering all my bases.
Yeah, so pretty much the same question, but it's, from an employer perspective, how do we take care of employees when they're interacting with customers, patients, clients, whatever it is? And the first rule is that kind of the same rules apply when we're talking about clients versus employee exposure. If you have a customer coming in who's like coughing all over the place and like just wiping their hands on people, you can ask that person to leave. That's based on a legitimate threat, a danger to both your employees and your other patrons. So long as, again, we're not doing that discriminatorily, we're not doing it based on national origin or where they look like they might be from. We can, in many cases, with respect to customers, try to exclude those people from our workforce or from exposing our workforce. But with respect to how do we allay employee concerns when they have to, maybe take care of folks that might be sick or things like that, I think, again, it's going to be the same rules. It's communicating with employees. What are we doing to take care of you? What do you, how do you wash your hands? Where are your cleaning products? What are the rules if you feel like you become sick? What if you think a patient or a customer came in with coronavirus? To whom do you report that? What are the rules surrounding that? And it's really just providing information and making employees feel more comfortable in allaying their concerns. So we don't have we can't stop them from getting it, and we can't say you don't have to come to work if you're scared, because that's not how it's going.
I mean, one consideration, not that you ever want to take HR advice from a doctor, but one consideration might be if you've got somebody who expresses that they feel vulnerable if they are potentially a transplant patient, I probably wouldn't put that person in the front door greeting everybody. So is it possible that we could, have a lateral move temporarily to mitigate that concern? That might be an example you can use.
And in that situation, we would. That's really good advice, because that would just be a reasonable accommodation under the ADA, right? This person has a known disability. How do we accommodate, especially temporarily?
I have two questions. One is on the, you'd call it coronavirus PTO. If we had a employee who had was running a fever but didn't have any PTO, so they wanted to come to work, it was corona. But we as an employer mandated that we don't want you here. Do we have to have a written policy that states that, or are we protected because we required them to go home and we're consistent in our application of that criteria?
You mean, do you have to have a written policy to pay them to stay home?
Yes.
The question is, if you institute coronavirus PTO, you're requiring someone to stay home. Do you have to have a written policy on that? And again, that's kind of a nuanced question, because if you have sick leave, you should have a sick leave policy. If you want to ever not pay exempt employees after they run out of sick leave for those days, you should have a sick leave policy. So generally speaking, you need to have a sick leave policy. Can we amend it for coronavirus? I think you probably should, although it's going to depend on, one, what your current sick leave policy says. Two, it's again case by case, because if this is an exempt employee and they're saying, I can come to work, I'm ready to come to work, and you're saying you have a fever, get the heck out of here, you probably have to pay them anyway, as we talked about before. And if it's a non-exempt employee or someone who's run out, I think it's best to have it written. So that, again, if you're saying, I'll give you up to 5 days of PTO, but after that, it'll be on paid time or whatever the case may be. That way you still are complying with the requirements under the FLSA and the New York labor law, understanding that as we communicate to employees, if you have coronavirus, we're going to give you 5 extra days of PTO, that's going to be a business judgment. So certainly something to think about as we, and whether we should amend policies, or maybe what documentation can we require. Those are the things we kind of want to think about but those again would all go into the policy. So I guess I run through the balance in my head. Yes, have a policy.
Okay. The other question is, we manage a commercial building. If we get a report that someone is visited or works there that has been diagnosed, is there a protocol to do we contact the county health department as far as advice on what is the procedure that we follow, what are we are required to do before we reopen the building?
So by the time it gets to that point, we will be all over you.
You'll call us.
He'll be telling you.
I will let you know.
Lots of help.
This question is for Dr. Mendoza. If we have an employee that wants to know, do I go to the hospital, do I go to my doctor, do the local doctor's office have the tests, or should we refer them to the hospital?
Do not refer them to the hospital unless they are emergently ill.
Okay.
A lot of questions about tests. Most tests that you get in the hospital don't actually live in the hospital or in the area. Most of the tests that we do, even at the U of R, some of the really exotic ones, they're called send-outs because we send them all. So the number of kids in the community is really not measuring anything. What we have in this community is the capacity to test anybody who needs it. And so what I would offer is have that individual contact their healthcare provider. We're working directly with the healthcare providers to educate them on how to get the testing done. But we certainly don't want to send everybody to the ER for these kind of issues.
I had a question, Dr. Mendoza. So we're, with Paul Davis, we do a lot of disinfecting services, and some of the higher risk people, like small doctor's offices and stuff, they're asking us if there's, you know, it's expensive if we disinfect every day, which we don't need to do yet, but if we do, are there any government programs that may come out to, like, for higher risk areas? Like, we do assisted living facilities, and we do doctor's offices, and they're just asking us, like, how much is this gonna cost, and how am I gonna afford this?
Yeah, I'm not aware of that side of the fence. I would say that in a doctor's office, there's very few other area that's higher risk than that. So if they're asking you to you know, it's probably because they want it and they should have it. As to how you pay for it, it's, I don't know how to advise on that.
I haven't seen anything. I love it.
I'm sorry, one more question. We talked a little bit about, what we can't ask employees about and what they volunteer. If an employee volunteers information that makes us concerned about the fact that they may be putting themselves in a risky situation and then coming into work and exposing others, this is a very specific case, but could apply to other things. We have an employee who works part-time for us, in a manufacturing facility, and the other part-time job she has is at the airport cleaning airplanes. So, she's
Whole room of us.
not airplanes. So, as an HR person, right, what do I do? So the question is, is there anything we can tell, you can't do that job, or you can't do that job and come here, because at this point, there's no cases through that airport, there's nothing we know about, it's not a high risk area, right, so we're trying to balance,
Yeah.
at what point we would say that's a risk to us.
So, other part-time work is not a protected category under any of our discrimination statutes. So in theory, yes, you can probably say, you can't come to work because we think that you could infect us, but would I recommend that? I mean, do you have employees going to the grocery store? Like, treating this person differently, it just seems kind of strange, because we're all going to places that are probably riskier, and, we don't know where the planes are coming from. Maybe they're coming from Florida where there are no known cases. Just kidding. Somewhere. But we're not really experts in that field, so if you had legitimate advice that said all airplanes are infected with coronavirus and there's no way she's not exposed, that's different to me than saying, oh, I decided that you have, my expert medical opinion. I might call someone and say, like, do you think this employee could be infecting us all? And then get that type of information, but just kind of sweeping generalizations about particular jobs would probably not be best.
So I have to apologize. I have to leave to give another talk at the United Way. So I want to thank you all for your time. If you have questions, please don't hesitate to reach out to my office. But like I said, please continue this conversation in your workplaces, in your homes, in your communities, because I think, truly we're at the beginning of what we think is going to be a several month long process. So with that,